My name is Marlo Donato Love, and I have multiple sclerosis. I've had MS for 12 years. I am an author of a book called Awkward Bitch, and I have also been a vlogger on the internet for 8 years. I get loads and loads of people writing to me, especially on my vlog, or putting comments on videos, asking questions that really they should be asking a healthcare professional. So why are they asking me? Because it's safe. I'm someone who they don't know. They can speak to me without being embarrassed because they see that I've done videos about sexual health, I've done videos about bladder control. I put it all out there, so they feel like, oh, okay, well, she has talked about it, and I have the same problem, so I can talk to her about it, which is great. But what we really need is a place or places where people can go to get accurate information from neurologists, from MS nurses, from pharma, from other patients. There needs to be places where people can get accurate information and they can get it fast. Because MS is a chronic condition, it's not going away. This is something that we have to deal with our entire lives. So we need information all the time. And if information is going to constantly be changing, then internet places and apps need to change with it. I was reading such an interesting article about this app for midwives that exists in underdeveloped countries. And in some places where the mortality rate of infants is so high, as well as their mothers, this is something that is changing the face of medicine in these countries, and it's actually changing the mortality rate. And if an app can be that powerful, then we need more apps for MS as well. I can't stress enough how information for people with MS is so important. When you've had MS for as many years as I have, you become somewhat of an expert patient, which is of course another reason why people are asking me questions. But there are people who are in rural places who can't get to a neurologist except maybe once a year. There's people who are not mobile enough to get to their doctors. I met a woman the other day who is so afraid of leaving her GP, who is in Scotland, and she now lives in London, that she waits to travel to Scotland to see her GP. That means if she has a relapse, she is not seeing anyone for weeks after. There is such a need. There is such a need for, we need it now.